So, welcome everybody. This is Toya from Raven Maven, and we are now in season 4, and we're going to be doing things a little differently since this pandemic has completely shaken the world up. We're going to be doing a lot more interviews, but they're going to be through live stream or sometimes even a live interview. So I hope that you guys like the new format of the show. And we're going to start off with a serious topic. I have today with me Miss Sandra Levons, who is, well, actually, I'm going to let her introduce herself and talk about what she does. And then we're going to jump right into it. So,
hello, everybody. My name is Sandra Levons. I'm a registered nurse. I work at Elmhurst Hospital, which is a city-run hospital, and it's known as the epicenter of the COVID-19 for Queens.
Wow, that is crazy. That's actually kind of intense because we all know now that New York is the epicenter for the virus. So to know that within that, the epicenter for the virus is at this hospital is very interesting. So what I've been seeing lately a lot on social media is a lot of nurses or people in medical professionals sharing their experiences and their frustrations during this difficult time. So, and most of them have been nurses of color, like Black nurses. And I'm glad to have you on here because, you know, you've actually managed and deal with a bunch of different personalities and you know what it's really like on the ground floor. So what has this virus, like what has the impact of the virus been for you on your career and like your day-to-day interaction with people and your staff?
Okay, well, my specialty is home care. So our nurses go to the patient's home after they discharge.
Wow.
And that could create say antagonistic a feeling effect because yes, they want the nurse to come in to see how they doing, but yet, especially because we're the nurses from Elmhurst, you understand me, they feel like they taking a chance.
Wow.
With us contaminating them. So it's win lose or lose win on both sides.
Right.
You do have the patients that, you know, was trust that, you know, personal protective equipment is being worn. And we do follow infection control because that is the most important thing with this virus at this moment. Because nobody really doesn't know how it's transmitted. They know the signs and symptoms of it, and still depends on your age and it depends on your comorbidities. A lot of people's signs or symptoms are very different. And now you even finding asymptomatic people, but yet testing positive and never get the signs and symptoms.
Right.
So in retrospect, you know, they want to feel safe with us at home, okay? And we want to be safe going into their homes, okay? So there is a protocol that you have to follow going in, not only if the patient is well, but if anybody in their family also has to be well. If anybody sneezing, coughing, or anything like that, or tested positive, the nurse cannot go in. Mm-hmm. I see a lot of the floor nurses, a lot of them do complain of PPEs, the lack thereof. Some of the nurses complain that the doctors are inexperienced, but if this is the first time they're dealing with this virus, everybody is inexperienced.
Exactly.
It's a trial and error,
yeah,
you know, to get it under control. And the one thing that nobody really thought would be getting it under control is medication for malaria.
Oh, yeah. Wow. Why do you say that? Why do you say that?
Because that is the medicine of choice right now.
For treating, or is that to treat people who are
COVID-19? Yes. That the hydrochloroquine chloroquine
Mm-hmm.
and the chloroquine. That is a drug that is used for malaria, rheumatoid arthritis, and lupus.
Wow.
But they find it effective when treating the COVID-19, also along with the Z-Pack. They're
Mm.
giving the Z-Pack also with the chloroquine, and it's showing progress. You know, I heard a lot of people is saying now that why they're using one drug to treat another, but there's a lot of medications on the market that is used for one thing, but the doctor take it and treats something else and it works. So
Right.
this is one of the medication that is showing good effects. There was a patient on TV. He said that he felt like he was dying. He was saying his last goodbyes to his family.
Mm.
Okay. And he asked for the medication. And he said by time the nighttime into the morning, he felt so different. He actually felt that he was getting better from the first time he got the virus. And he's one of the ones that the virus really hit hard.
So in the news, we've been like hearing a lot about the ventilators and how much the mayor and the governor have been at, like, you know, lobbying with the president and the government, the federal government, trying to get as much ventilators to the state as possible, and also expand the capacities of a lot of our medical facilities. So these are some of the terms are new to me, like a Z-Pack. Can you just tell us what that is, and also what a PPE is, and the importance of that for, like, not only your safety but also patient safety? And then also, how does the ventilators come into play with these other pharmaceutical treatments that you guys are implementing right now to help people with COVID-19?
Okay, the Z-Pack is Zithromax. It's a 3-day antibiotic regimen treatment.
Okay.
Because usually antibiotics usually is 5, 7, and 10 days. But they have this Z-Pack, came out several years ago. It's been out for a while. That is a 3-day regimen and is antibiotics. Yes, it's an antibiotics with an antiviral, but it's showing treatment. So we really don't understand how this virus is working.
Right.
But if we find something that's fit and is not harmful for the patient, why not try use it, although it's unconventional?
Right.
Now, PPE is personal protective equipment. There was a nurse, I believe, case manager, nurse, a male. They said that he died, and people from his hospital is saying that it's due to lack of PPE.
Mm.
Now, due to the PPE is your gown, your mask, your eyewear, your gloves.
Mm.
Those are very important in protecting yourself and even protecting the patient. Because we have to realize that testing just started. So there was a lot of people walking around with this,
Mm-hmm.
okay? Didn't know they have it at one point. And because you're asymptomatic, you still could transmit it and could come home and give somebody in their family who have like comorbidities, asthma, heart failure, cardiac problems, COPD, which is chronic obstructive pulmonary disease.
Mm.
All of those are easy for to get a hold of this virus, for this virus now to take over in your body and do as it please.
Right.
Because you're already compromised.
Right.
Now the N95 is called a particulate respiratory mask. It's supposed to block out at least 95% of the airborne particles. That's why it's preferred use. Because the other masks really don't filter anything out.
Right.
But I still say a mask is better than none at all.
Right. I also wanted to touch on, I was reading an article about a lot of fashion brands. They're making masks. And I even have one from a fashion brand. And I just wanted to share with you guys that, like, like Sandra's saying, that a lot of these masks, like, for them to filter out, they need to have certain features in them. And just a cloth mask isn't going to do enough. I still wear a mask without the filters, because you can add that in, and some masks come with, like, you could put a filter inside of your mask. But just be very cognizant of the fact that if you're just wearing like a plain fabric mask, like, that's not enough protection. And really, the masks are really for people who are sick and not people who are not sick. So you might want to take that into consideration. I'm not a medical expert, but this is just based on the things that I've read from reliable resources. What are your thoughts as far as, well, let's change gears for a bit. For you, like, since, did you, at first when the virus started to become more real, because I think a lot in the beginning, people were, it seemed so far away, and it seemed like it wasn't going to be an issue. But now that it has really, like, changed how we're living our day-to-day lives, how has that impacted you, like, emotionally and psychologically? Because this is just, like, so crazy that a lot of us went from going to work every day, socializing, hanging out with our friends, and now, like, I have to, like, FaceTime my friends more than I would like to versus seeing them, So, like, how has it been for you? Because I know you're still going into the office, right?
As of today was my last day going into the office.
Wow.
Yeah.
Hey, yeah, because I get worried because I have so many family members that are working in the medical field, and you're putting yourself at risk being in the hospital. So I'm happy that you're able to, I guess you're going to be working from home now.
Yes, but
Okay.
you got to remember, we took that oath.
Yeah.
You know?
What is
That's
the
what.
oath exactly? What is the oath? Like, what is in, I don't know if you remember verbatim, but what does it mean exactly? What is the oath? Like, what are you promising to do?
We are promising to do. I am promising to look at you non-judgmental.
Mm-hmm.
I am promising not to put my beliefs onto you. I am promising to do my best. Okay. It's a Hippocratic oath.
Mm-hmm.
Okay. It's a long oath. It's nothing people actually remember. They give it to you on a card and you say it. You understand me? But the whole concept of nursing is like mothering.
Right.
You understand me? So I'm going to make sure I do the best for you before I turn my back and leave you.
Right.
Okay. And if I have to come back, I will tell you so, that I couldn't do X, Y, Z. And I'm working on it, and I will try to do that.
Right.
But as nurses, we have a different mindset, because what normal people will run away from, we run towards.
Right.
And that's the difference of how we think or how our brain operates. Because we are problem solvers. We try to find a solution. The doctors write what they want, but we have to implement it.
Right.
But not all things are implemented the way it was written.
Right.
I might have a patient that can't swallow too well, but not bad enough that I could say, or worse, that I would have to get a liquid medication. But I know if I give them the medication and, like, gently massage, for them to swallow, different things like that, to solve the problem that the patient has.
Right.
So we want to keep you protected, keep you well, but we want to keep ourselves protected and well also.
Right.
Because when we leave you, we have families to go home to.
Right. Some people, I've seen like a bunch of different comments on like nurses. There was recently, I'm going to show some of these videos in this episode, but there's recently a video with a nurse who like she put in her notice because her supervisor was going to put her on the COVID floor, and she just felt like she already is also a compromised immune system. I think she was like a cancer patient probably before in some time in her medical history, and she just and she has children, and she's the only person who is supporting her children. So she decided to quit her job as a nurse, in protect herself, because she just felt like she was not in a position to like risk her life on that level. And it doesn't mean that she's not committed to providing professional health care or care about people, but you know, a lot of people like had some really strong feelings about it, like on social media. Like some people like felt that, you know, you took an oath and you're supposed to put these people first. And I guess it's just like a fine line, because it's like, okay, like when do you say, in this field, I guess, when is it okay to say, okay, my life is just as important as the person that I'm taking care of, you know?
Well, with her, if she's compromised, she can save her life. Who's going to care her children?
Exactly.
Okay, in life, these are the decisions that we have to make, and there's a lot of decisions that was made for us.
Right.
Okay, social economics. Look how much restaurant waiters, by the snap of your finger, or by the call of the day, 5 o'clock, everything has to come to a halt.
Mm-hmm.
Okay. Medication. I had to go for my medication. I had to stand outside of Walgreens a good half an hour. Stand inside the line. Okay. And by law, I'm handicapped. Okay. I'm not supposed to be standing outside on a line, then go inside and stand on another line also to get medications to help me breathe for my diabetes. But that's the way of the world. It affects all of us in one way or the other. I have not seen anybody that this has not affected.
Right.
At all. It affected us one way or the other, our family, our community. And a lot of time is our community is the one that have our back.
Right.
But we can't say that now. Okay, first you got to look for self, and then you have to call your neighbors, elderly people. It's hard for them to get groceries. There's people that had a job today and have no job tomorrow. There's millions of people out of work because of this virus. Do you think all the mom and pop stores are going to come back? I don't care how much grants they give or loans, because grant is beautiful. But when you're talking about a loan that I got to pay back,
right,
that's hard. When you're talking about staff that I have to pay and bring back, that's hard. How about the people that just opened their business a month or two ago?
Right. Yeah.
Or 6 months ago, and just seeing that margin started to climb. This affected everybody, and I felt the 2 weeks that the president took his time, I felt that was 2 weeks that we lost.
Yeah. to try to get ahead of it, of like, you know.
Or even try to get a hold of it.
Right.
Because even you might not get ahead of it because it started somewhere else and migrated here.
Right.
But even to get a hold of it, to take control of it, so you could control now the spread of it.
Right.
But it already went rampant for 2 weeks. And still people not listening.
Yeah.
You see kids in the park with their parents with play dates.
Right.
You see guys with their fellas, they ain't got to go to work, but they shooting hoops.
And working out together and all the things they're not supposed to be doing, people are doing.
Everything that, and then when you get it or a family member get it, you cry, you have bad luck.
Mm-hmm.
And can I tell people,
mm-hmm.
when you have on your gloves, please don't use the same gloves outside, then go in your car and drive. You just took everything, every doorknob, every handle, everything that you came in contact with in your car. Take the gloves off. Clean your hands. Drive your car. When you come out your car now, don your gloves and put on your mask. Don't take that same mask and gloves and go into your house now and start doing things.
Yeah.
Because you just contaminated your whole house.
Yeah.
You have to change them at one time. Whether you want to or not, you have to change them. You have to take them off. You have to wash your hands or use sanitizer and don another pair of gloves. But this practice of driving with gloves and mask on, and you just came from outside and touched about 50 doors, that's not even common sense.
Right. Has your experience with this been very stressful as a medical practitioner?
Yes, because you don't like to see people around you getting sick or dying.
Right.
We're in the business of helping people feel better, and it's beyond our control. The doctors is a trial and error because they're not experienced.
Wow.
This is something we never fought and battled before. And as a nurse, I've seen the bird flu, swine flu, Ebola, but nothing like this.
Right.
Nothing at all like this. Because you still can't get a hold on the transmission. You can't get a hold of the signs and symptoms of the age group. At one point, they told us young people seemed like they wasn't getting it. But yet, a 8-year-old boy, a newborn baby, okay, a 36-year-old principal, it's not as they told us in the beginning that it had to do with elderly people and people with comorbidities.
Are there any other myths that you would like to debunk about the regarding the virus right now? Because I think at one point, like even like, you know, Black people thought they couldn't get the virus.
I heard, and then they say Black males felt they couldn't get the virus.
Yeah.
And then on the internet, they start putting about take vitamin C. Vitamin C is good for the cold, good for the winter time across the board. But vitamin C is not going to help your signs and your symptoms, and it's not going to help you combat the COVID-19.
Correct.
But it's good to build your immune system to help you fight anything that comes your way.
Would you recommend any certain types of food or anything that could help build or strengthen your immunity while, like, you know, as long as we're under impression that we're not infected already, you know?
Well, as a nurse, that has to be very careful because a lot of people has allergies, and the first thing they say, oh, she said. Okay.
That's true. Yeah.
All right. So disclaimer. Okay.
Right.
You're allergic to certain things, stay away from them because you know you're allergic to them. But eat your fruits and your vegetables, your protein, and everything don't have to be animal-based. Everything don't have to be plant-based.
Right.
You can mix it up. It could be your preference. Okay. Keep your immune system going. Okay, take your vitamin C's. Your fruits and vegetables give you your vitamins and your minerals.
Right.
Your protein give you your strength and your ability to fight and warn off things. You know, I'm not too big. I'm a diabetic, so I'm not too big on too much starch or anything like that.
Right.
You understand me? But if that's your preference, moderation. Everything in moderation is the way to go.
Right.
And what might not be good for me might be good for you. What might be good for you, I can't touch. So just keep that your protein, your vegetables, your fruits, and wash your hands, wear your gloves, stay 6 feet from people, because people don't realize when you speak, your saliva can actually travel 6 feet. That's why they tell you to stay 6 feet away
Right.
from each other.
So,
Because you could breathe in my saliva.
So I'm gonna wrap up because I know we're on a tight time straight with these recordings, but I just wanted to say thank you for sharing, your experience and insight on this from your perspective, especially as a Black woman and as a Black nurse. And where should people go to just keep abreast about, the developments of the virus? And is there any other words of encouragement you would like to share?
Well, you could always call 311, or you could always Google COVID.
Mm-hmm.
Or you could go on the New York Health and Hospital website. They have a lot of information there also. And what I try to tell people, that we all in it together. Okay? We all have to be alone, but we don't have to be alone. Thank God that we have, technology that we didn't have before, that we could even make this happen.
Right.
Okay? And keep your faith up. You understand me? Because sometimes with everything that I do, my last word is to God, keep me and my family safe and with good health. Because with all the wealth in the world, if you don't have good health, that wealth means nothing at all.
All right. Well, thank you.
You're welcome.
So that's a wrap, guys. Thank you. And make sure that you like, subscribe, and share this video. And join us next Monday for another episode. And thank you for watching Maiden Maiden. And thank you, Sandra, for being part of the show. I really appreciate it.
Thank you, everybody. Bye-bye.